So here's your solution if you have swollen gums. So there can be a handful of reasons why our gums are swollen, but when they are swollen, it means they're inflamed. A couple reasons can be plaque on the teeth, mouth breathing, medication induced. There's got to be more. Yes, hormonal changes. That was the other one. But the most common reason is due to plaque. So I'm going to kind of touch upon that a little bit and how to take care of it. So what ends up happening is that your body is sending blood flow to that area because you have bacteria on your teeth, and it's sending blood flow there to help clean up that bacteria. The blood flow is in the tissue. It goes all the way to the edge of the tissue and the capillaries, and it's trying to clean up that bacteria and get rid of it, which causes the gums to swell because of all of that extra fluid in that area. It also makes them tender because they swell. Think of like, say if you broke your wrist or sprained an ankle or something, your body sends blood flow there to help heal it, sends inflammation there, and it gets swollen and tender. So the best way to help with this is to focus on plaque removal of the teeth every single day. So how you would take care of this is through daily home care that focuses on plaque removal and taking care of your teeth and gums. So I would recommend water picking with warm water twice a day to help flush out in between the teeth, and you're going along the gum line here, so it helps flush out anything underneath the gum line too. And then brushing twice a day, ideally with an electric toothbrush, making sure you're not to scrub, holding it on each tooth. My favorite electric toothbrush is the Oral-B iO. It's amazing. And then by doing that twice a day as well, you're removing any plaque buildup on the teeth. You can also floss if you don't have access to a water pick. Flossing, you just have to make sure you're adapting the floss to each side of the tooth, really scraping each side of the tooth and getting underneath that gum line to get this part clean. And consistency is key. So if you're like skipping a couple days and doing this maybe once a week, it's not going to make a huge difference. But if you do this every single day, it'll probably take about 14 days to completely reverse your gingivitis, or that's what we call swollen gums. If that doesn't help resolve it, there could be other reasons. You could have something going on under the tooth. You could have some food getting caught in that area. You could have an open space between the teeth. As I said, it could be medication induced. You could be mouth breathing, and that's drying out the tissues, which is causing them to be more irritated. And it could also be hormonal, and especially with pregnancy. Pregnancy causes gums to swell because of all the hormones. But the number one thing that you can do to control what you can control is good home care, and start there and see what happens. Hope that helps.